Hi, good afternoon. Dr. Jerry Carapang here from Return to Sports.fun here in St. Louis, Missouri. Uh, here in our Sky Terrace, and just would like to make people realize that we're having a beautiful, nice weather here, and anyone who's trying to overcome an injury or anyone who's trying to overcome surgery from an injury deserves to enjoy a beautiful weather like so, right? So hopefully people would realize that one of the treatments that we do in pain management is providing a cortisone shot for someone who needs it. However, a lot of people are quite hesitant in submitting to it. They're scared. They think that it's not going to help them. They think it's bad for them. So you won't miss out. Our topic for today would be: is a cortisone shot good or not good for you? And we'll let you enjoy this nice weather with us. And we will be back in a second and discuss that interesting topic. So we will be back in a second. Again, our topic would be: is cortisone shot good or not good for you? Dr. Catapang from Return to Sports.fun here in St. Louis, Missouri. We'll see you in a bit. Hello again, Dr. Catapang here. Now we're back indoors after enjoying the beautiful weather we're having outside. So back to our topic. When is a cortisone shot good and not good? To have it or not when in pain? This is a tough question for some patients who are in pain. Some are even stuck not knowing what to do next. So what are we going to do? So it is not uncommon for patients to gather unreliable information online or opinion from friends when making their decision. This makes it even tougher for them to decide whether or not to have a cortisone shot when in pain. Is cortisone shot good or not good for you? Interesting, isn't it? And more interesting, the answer is yes and no. When does the answer becomes a yes? Let's explore. Number one, yes, it is good for you. A cortisone shot is good for you when it is a medical necessity, and if the number of shots provided is within what is considered a medical safe number of shots within a year. That is number one. Number two, when in pain due to an inflammation secondary to a structural damage as a result of an injury, and surgery is not indicated. Therefore, a cortisone shot can be beneficial for you. Number three, when in pain due to an inflammation secondary to a disease such as arthritic conditions and tendinitis, or as a result of an injury such as spinal disc issues, a cortisone shot can also be beneficial for you. Number four, when in pain due to an inflammation and after a few months of surgery, there is still pain, then a cortisone shot can be beneficial. Number five, when in pain due to an inflammation and oral medication was not enough. This is also an indication that the inflammatory process is more severe. A cortisone shot can be beneficial. Interesting facts, were they not? May this be a guide for you when decision come times for you. Now, when does the answer becomes a no? No, a cortisone shot is not good for you if the number of cortisone shots provided is more than what it is considered within the normal medical limits. There's a concern, that repeated cortisone shots might damage the cartilage within a joint. So doctors typically limit the number of cortisone shots into a joint, and in general, you should not get cortisone injections more than every 6 weeks, and usually not more than 3 to 4 times a year. So that is the limit. Commonly, medical providers do not usually get to that limit for safety purposes. Therefore, a cortisone shot is not bad for you if the number of shots provided is within the normal medical limits. So, for a patient to have a good decision whether to have a cortisone shot or not, it would be beneficial to know the indication and the limitations. This is important for patients to know, or they would miss out in achieving a maximum physical recovery when in pain as a result of a disease or an injury. The big question now is, why did a cortisone shot not work? Or why did a cortisone shot lasted only for a short period of time? Another interesting topic, isn't it? The answer to this question we have in our next blog, and is posted on www.returntosports.fun, yes, .fun, and we hope that this information helps. And please share, like, comment, and subscribe so we can help more patients along the way in trying to help the injured return to sports in function at the earliest possible time and for them to achieve their maximum physical recovery. Dr. Karipang again from returntosports.fun. You have a wonderful day, and we will see you in the playing field. We'll see you later.